Okay, hi everyone. I'm going to do my final project on common chemicals found in popular personal care products. And my name is Rebecca Phelps. Did you know that 60% of what you put on your skin is absorbed into your circulation? Common everyday products that most of us find to be safe as we put them in very intimate places. And from companies that we have assumed and trusted have our best interests in mind, such as Dove, Secret, Pantene, Chapstick, Vaseline, Tampax, etc. We've just found these common everyday products to be safe. But as I've learned through organic chemistry, it's really brought to light for me a lot of the chemical names that are in these everyday products and many of the common and popular products that many people use every day. So I just like to take a closer look into the products that are in our deodorants, our shampoos, our lotions, our lip balms and sunscreens, and even our personal hygiene products as women. Okay. Okay. People are exposed to chemical ingredients of our personal care products in many ways. The main and obvious being that they're absorbing them through the skin, which is the largest absorbable organ of the body. So we're breathing in these sprays and powders, swallowing chemicals on the lips, even through toothpaste, or we just have them on our hands every day in common ways. Biomonitoring studies have found that cosmetic ingredients such as phthalate plasticizers, paraben preservatives, and pesticide triclosans, synthetic musks, and sunscreen ingredients are common pollutants in the bodies of men, women, and children of today. Many of these chemicals are potential hormone disruptors. So I also learned that FDA's legal authority over cosmetics is different from the authority over other products that they regulate, such as drugs, biologics, and medical devices, even food. Under the law of cosmetic products and ingredients, they do not need the FDA pre-market approval, except for with the exception of color additives. So in the 1950s, there was a sparked interest of using chemicals in new products instead of the more expensive alternatives that they would use instead. We've made a lot of these products cheaper and more accessible by using these chemicals, but we haven't looked at the long-term effects. So in the 1970s, since 1976, only 11 chemicals have been taken out of cosmetics in the United States, and then the European Union has restricted 1,100 of these chemicals in their products since the 1970s. So 1,000-fold. With the exception of color additives and a few prohibited substances, cosmetic companies may use any ingredient or raw material in their products without the government's review or approval. And this has been since 2005. So even since the most recent times, there's not been many regulations and changes that have been made. And to begin with, this is the key personal care products and their ingredients are not regulated in the United States. Under the 1976 Toxic Substances Controls Act, all of those products that we rub, lather, and spray onto our body require no testing for safety or toxicity before going to market. We have no idea of the reproductive risks and the developmental issues or the cancer risks that they're causing on our endocrine disorders. The ingredients that we know now do have these effects and have not been removed or banned. It's up to the manufacturer to do the voluntary testing and share the results with their consumers. And they only, not the FDA, have the authority to remove their product from the store shelves. So the FDA's legal authority over cosmetics is different, like I said. And we're going to take a look at some of these certain chemicals that are still allowed on the shelves and in our products. They have not been banned. Okay, so we're going to take a look at those. So we're going to do some of these common chemicals and break them down. We'll start with sodium lauryl sulfate. It's the cheapest way to create a foam. And it's found in common in body wash, shampoo, foaming cleansers, and even in toothpaste. Although they are also found in engine degreasers, garage floor cleaners, and car wash cleaners for its corrosive abilities as attacking greasy surfaces. These are also surfactants. These reduce the surface tension of the product so that the product is easily spread onto the body. It's the cheapest way to create a foam, like I said. And the SLS will disrupt the protective layer of the natural oil of the skin and open it up to bacteria. This oftentimes can be the cause of the recurring and chronic bacterial acne. All of those sudsy products like shampoos, body washes, etc. contain sodium lauryl sulfate and have the byproduct 1,4-dioxane, which is a known carcinogen that is suspected to also cause kidney, nerve, and respiratory problems. Unlike many other countries, the U.S. government does not limit formaldehyde, 1,4-dioxane, or any of the most hazardous substances in personal care products today. As a result, the independent lab test found these chemicals in dozens of products, including Johnson & Johnson's baby shampoo. These companies claim that the chemical levels aren't large enough to worry about, but I would say differently. The International Journal of Toxicology states that the SLS has a degenerative effect on cell membranes because of its protein denaturing qualities. This means that it's actually accelerating the aging of your skin and not helping with the de-aging of your skin. So we'll go to propylene glycol, which is also butylene glycol, aka antifreeze. This is used as a softener or a solvent, including wetting agents. And it penetrates the skin fast to weaken the protein and cellular structure and can cause brain, liver, and kidney dysfunction. Okay. Next, we have sodium hydroxide, which is Drano. That's right, I said it, Drano, and it is used in toothpastes, for goodness sakes. It is for whitening purposes, so I guess if it cleans your drain, it'll clean your teeth. Mineral oil, which is also baby oil, aka liquid paraffin. Don't be deceived by the name, though. There's actually no nutritional value in this mineral oil. It's actually a petroleum derivative from a petrochemical containing neurotoxins. And it's made through the distillation of gasoline, which is why it's a petroleum derivative. This also includes products such as Vaseline that a lot of people put in private areas, not to mention the mouth. Parabens. Parabens are a big one. A lot of people are talking about these days, but they're used as preservatives in many cosmetics to reduce the spread and growth of bacteria and fungi, but unfortunately they are absorbed directly through our permeable skin and are stored in our body organs, even our brains, and affect our hormones. They have the ability to mimic estrogen cells and fit into estrogen sites that turn on body systems stimulated by estrogen at the binding sites. The Journal of Applied Toxicology found that breast tissue taken from breast cancer patients was found to have actual paraben molecules intact within the tissue. Scary. So here are a list of few others. There are a long list of different chemicals that are in our everyday products, but these are just a few of the ones I found to be most common and most prevalent in common products that are on the shelves. So these include polyethylene glycol, which is a PEG, reduces the skin's natural moisture, also increases aging of the skin. DEA, MEA, TEA are hormone-disrupting molecules outlawed in Europe. These amines usually are found in lubricants, paints, and cleaners. Urea is a preservative that releases formaldehyde, which when inhaled is toxic. And also, many products contain triclosan, which is a pesticide, and isopropyl alcohol, which ages and dries the skin, promoting wrinkles and brown spots. Doesn't sound like many of these things are doing what they claim to do. Okay, so results. In doing the research for this and seeing all of the chemicals that we do have in our personal care products and cosmetic products today, I have found that the carcinogens the amounts of carcinogens in our products doubles every decade. We have a long list. I mean, like I said, Europe has outlawed 1,100. We've only outlawed 11. So there's at least over 1,000 that we have that are still on the shelves today in common everyday products. So common everyday products that most of us find to be safe, like I said, as we put them in very intimate areas under our armpits, on our face, in our hair, on our scalp, in our mouth, and our teeth, are perhaps not as safe as we thought. So like I said, Europe has actually outlawed, I'll give you a list of a few of those that they have. They include a long list, but I'll give you a list of the things that we have outlawed, in the United States, and that includes biphenols, chlorofluorocarbon propellants, chloroform, which we all know what chloroform is, halogenated salicylanides, methylene chloride, vinyl chloride, and zirconium-containing complexes. These are just a few of the ones that have been outlawed in America. So in conclusion, biomonitoring studies have found that cosmetic ingredients such as phthalate plasticizer, paraben preservatives, and the pesticide triclosan, synthetic musks, and sunscreen ingredients are common pollutants of the bodies of men, women, and children. Many of these chemicals are potential hormone disruptors. So in conclusion, I would say that you must read the ingredients label on everything that you use, not only what you eat, but everything that you use, in order to be sure that what you're putting on and in your body is pure and not going to harm you or disrupt your hormone balances and therefore your body systems and your brain activity in any way. I hope you enjoyed this presentation.